Evening that we're about to learn something great. It's actually something that is affecting every woman. If you are just a female gender, this is something that will be affecting you. And sisemi ni kila mtu, but most probably unaweza kuwa unaelekea hapo ama ulishakuwa hapo, and it is good to learn and relearn some things. There are so many myths about it, there are so many things surrounding it, but today we are here to lay down the facts and also to make sure that you understand what it is and why it's important for you to know, and don't diagnose yourself, because there are other symptoms you can feel and zinakaa kabisa kama ni hiyo, but kumbe sio hiyo. Ukijidiagnose mwenyewe unakuta kuna mahali umefanya kamisi kidogo. But don't you worry, that is why we are here. We want to talk about uterine fibroids, and that is very very important kwa sababu if you've ever had pelvic pain, umekuwa na discomfort, umekuwa na heavy flows, this conversation is for you. This is the time for you to start sharing the live. Share the link so that everybody will get to learn this. If you have a sister, you have a cousin, you have a wife, this is information is for you. Start sharing this live to them so that also they can learn something, relearn some things, and of course unlearn some things that have already been taught to them. Here we lay facts down, and I make sure I bring people who understand the facts about it, and they tell you as it is in the simplest term ever. Unajua ukienda kwa daktari na kufanyia na kuandikia unajiuliza na hii ni nini ameandika, but I bring them on board so that they can explain it in the layman's language to say ndio uweze kuelewa vizuri. And of course to join me today is a very good doctor who will be explaining all this to you. So kama uko na zile maswali, uko na zini zinakuwasha kidogo, you say I really wanted to ask this question, my line will be open in a few. But before we start that, let me invite my guest so that he can introduce herself, tell us where you can find her, and of course why women advocacy of health. Karibu sana doc.
Thank you, Trevilla. My name is Dr. Imelda Ntinyari. Yes, and really passionate about issues affecting women, whether they are health issues or you know, gender issues, feminism issues. Generally, I'm very passionate about women, and I'm here today to talk about uterine fibroids. And as Trevilla said, to demystify any of the myths and misconceptions that are being spread out there, and to lay out the explanation on how fibroids may present in layman's terms, so that you may be able to understand the condition better. It's actually a very popular condition in women. Fibroids are literally one of the most common benign tumors in women, and African women are actually more affected. So it's very important that we are informed on this issue.
Wow.
Thank you.
And thank you so much for considering coming, even the invite. I know we had ulikuwa na scheduled sites, but you slotting us in, we really, really appreciate. But before we start, remember you can partner with Oracle TV. It's very simple. It's very easy. You go to a paybill number 171133. Account is Oracle TV. That will make sure that we are on air 24/7, and we make sure that you get quality content. When I say quality content, this is what I mean. We bring in doctors, we make sure we bring in people who will add value to your life, who will add value to your spiritual life, and also who will add value to your businesses. So make sure you support Oracle TV through the paybill that is running on your screen. Once you've done that, just write to me that I am a partner, and of course I'll be glad that you've partnered with us, and you did this stuff for a good cause, and you can never regret partnering with Oracle TV. To start us off, Daktari, what actually is uterine fibroids? Because there's so many different explanations you get out here until you're like, hey, so what really is it?
So to define fibroids medically, fibroids are non-cancerous growths that occur in the muscular layer of the uterus. Medically, they are known as leiomyomas. So if you hear a doctor tell you have a leiomyoma, that's basically a fibroid. Yeah, so it's not a cancer. It's benign. Benign means that it's not cancerous, basically. Yes.
Also, it's not cancerous, because we have so many people thinking, once you are told, because kuna daktari mashakwambia there's a tumor, and you're like, wow, this is cancer, and I am going to die, just I'm counting months or so for me to die. Kuna ule mtu anaenda kaambua yako iko sijui centimeters ngapi, and they are like, wa, so mtu akifika kwa daktari, what is that first thing they should expect once they get the term that you have fibroids, or what are the specific things that the doctor would look at and tell you that you have fibroids?
So before I answer that question, first of all, I want to demystify that a tumor is not a cancer. A tumor simply means that there is abnormal proliferation of cells, basically a growth. Sometimes you might even notice some people when they pierce their ears, they have some growth here. It's called a keloid medically, but that can be considered a tumor. Basically, it's any abnormal growth of cells. Yes, but a cancer is a tumor that can spread to other parts of the body.
Oh, so the difference is this cannot spread.
Yeah, so this cannot spread. This is localized, basically. Yes, so that's the difference. So back to your other question, you are asking what are the clinical features that one will present with when they have fibroids. So one of the most common clinical features that patients present with when they have fibroids is heavy menses, which medically we call it menorrhagia. A patient will come in and tell you that they have been experiencing their very heavy periods for like more than 7 days. Their pads are soaking in less than an hour or even 30 minutes. They are constantly, my mother once had fibroids. Yeah. And I asked her about it, and she was telling me that her pad would fill within like 10 minutes. So when she's outside, she's constantly checking if she has stained herself or something. So that is one of the most common symptom of fibroids. But there are others. Actually, pain is an uncommon symptom. I heard you mention pain. Yeah. It's uncommon, but it can occur in some cases, but it's rare. So the most common is basically heavy menstrual bleeding. The other symptoms are related to the location of the fibroid. For example, if the fibroid is located anteriorly, it will press on the bladder. Yeah. So you might experience urinary symptoms, and these might include urinary frequency, an increase in urinary frequency. Suddenly you're going to the loo more often to pee, or urinary urgency, which basically means you cannot hold in. You see, normally you can hold it in and sit, but you can't hold it in because it's pressing on your bladder. Or if it's located posteriorly, it can press on your rectum, and that will cause constipation. So those are generally called pressure symptoms, depending on what it's pressing. So another symptom, which I wouldn't really call it a symptom, I'll call it a side effect. You can experience subfertility. So that means it's not that you are infertile for life. You're basically infertile for the moment period because of the fibroid, and this does not happen in all instances. For example, the fibroid can grow to a point where it blocks your ostia. The ostia is the opening where the fallopian tube connects to the uterus. So if the fibroid is blocking that, of course the ovum won't be able to come to the uterus and get implanted. So in that way you can experience infertility. Or if you have a type of fibroids that we call submucous fibroids. So they are located nearer the endometrium, which is the inner layer of the uterus, so they can interfere with implantation. And that can affect fertility, but we'll talk about the types of fibroids later. Yeah,
actually,
so that can be better
mentioned one type of fibroids, and I was like, are there types of fibroids? Because once we understand fibroids, we know fibroids is fibroids. Okay, ambacho uko na fibroids unasimamia hapo. Are there types of fibroids? And kuna ile yenye ni way much better than the other one.
Well, technically, yes, actually. So there's a medical classification, but it's more anatomical. Basically, the classification is based on the location of the fibroid. So let me teach some basic anatomy. So the uterus has 3 layers, right? The innermost layer is called the endometrium, and that is the layer which sheds during periods. Yeah. Then the middle layer is the muscle layer of the uterus, the smooth muscle layer of the uterus, which is called the myometrium. And that is the layer where fibroids grow. Fibroids actually grow within the myometrium only. And then the outermost layer is the serosa. So we classify fibroids according to the location, because most fibroids occur within, not most, all fibroids occur within the myometrium. If it's in the middle of the myometrium, it's called intramural fibroid. That's one type. Then if it's nearer the endometrium, as in it's not in the endometrium, but it's squeezing on the endometrium, it's called submucosal, and that is the type of fibroid that I said is more associated with subfertility, because it interferes with implantation. It's somehow altering the structure of the endometrium. You know, the endometrium is supposed to be smooth and all. Then there's something pressing on it, and that type of fibroid is also the one which is mostly associated with heavier bleeding, because now during periods it will also like cause your endometrium to bleed more heavily. Then the last type is called subserosal. It's nearer the serosa, which is the outermost layer. So the least symptomatic, that was your question, right?
Yes.
Is there one which is least symptomatic? Yes, the intramural one. It's in the middle, so the bleeding might be less, especially if it's small. But if it grows larger, regardless of the location, the symptoms will become more severe.
Wow.
Yes, so those are the types. That is the only classification
that we have.
Yes.
And maybe what really causes fibroids? Because it's just not can't appear like that. What really is the cause? Ama kuna vitu zenye wanawake hufanya and inafanya you get the fibroids, ama there are things you're supposed not to be doing for you not to get the fibroids, ama tu upende usipende, kuna tu venye tu inaweza tokea.
Okay, so the unfortunate thing in medicine, not all diseases have an exact known cause. You know, for example, the way for malaria, I can say, you know, the cause of malaria is Plasmodium falciparum. So for fibroids, there's no exact known cause. But what we know is that fibroids are basically hormone-dependent tumors. What promotes their growth are your hormones, estrogen and progesterone. But there is also a genetic factor. Yes, there's a genetic factor. We can have genetic mutations which can lead to growth of fibroids. For example, in some genes like MED12, but that's unnecessary for the audience because we said we are making it simple. So it's more of genetics and hormones. Yeah, but now it is not guaranteed that we all have the hormones, but we don't all get fibroids, right?
Yeah.
So it's more of the genetic component. But what we can talk about are some of the risk factors that might increase your possibility of getting a fibroid.
Fibroid, yeah.
So number one, this one is unavoidable, race. So according to studies, African women, or generally African Caribbean women, are more likely to get fibroids. The cause is not exactly known, but it is stipulated to be maybe because of maybe it's because of the hormonal differences. There was a theory I read somewhere that it could be because of our dark skin.
Yeah, I was
you know we get vitamin D from the sun. So vitamin D might penetrate less in dark-skinned people. That was a theory, but it's just a theory. I won't give it much weight. But other factors that can be now controlled, we have obesity.
Oh, it's a problem.
So it can be a problem. Reason being, I told you that fibroids are driven by hormones. They are hormone-dependent, estrogen and progesterone. Now, the hormone estrogen, how is it produced? It is produced from testosterone. Testosterone is converted to estrogen through an enzyme called aromatase. That enzyme is found in fat tissues. So the more fat you have, the more estrogen you produce. So basically, you have a higher estrogen burden, so you are at a higher risk of fibroids. There's something to do with ingesting red meat. So that's a lifestyle thing. Because ingestion of red meat and obesity are not really that far apart. Cousins. So they are kind of interrelated. Having conditions like hypertension for the same reasons. Mostly hypertension is caused by dietary habits. And then is there anything I haven't mentioned which is preventable? Oh, so some other things that might increase your risk of getting fibroids is there's something in medicine we call nulliparity, which is just, they're just trying to complicate simple things. So that means a woman who is in reproductive age but hasn't delivered.
Oh, so if you are in a reproductive age and you've not delivered, you're at a higher risk of getting...
Yeah, but the only reason you're at a higher risk of getting fibroids is because for the woman who gets pregnant, for 9 months, she's in a kind of a menopause, you know?
Yeah.
The hormone circulation
has stopped, kind of.
Has, yeah, kind of shifted. But for a woman who is, you know, not pregnant, has never gotten pregnant, there are no such breaks. So you're at a higher exposure of the hormones. And then there's something we call early menarche in medicine. So menarche is the age at which a woman starts menstruating.
Oh, because I wanted to ask what type of women are at a high risk of getting fibroids. And I think that is what you're answering.
Yes. So those are some of the risk factors. So it is not guaranteed that if you have any of those, you'll get fibroids, but it increases your chances if you have the genetic component, you know. It's not like guaranteed that now because you have not given birth, you're going to get fibroids. Or because, you know, you eat red meat, you're going to get fibroids. They're just factors that increase the chances if you have the underlying risk factor, which is the genetic mutation. Then I think there was something I was about to mention, but I've forgotten.
Yeah, I think you remember. And I was to ask, because we are being told some diseases are inherited. Can you inherit fibroids? If your grandmother had it, your mother had it, and you are seeing your sister kinda, kuna vile, can it lead to you having fibroids?
Not always. You know, genetic mutations, I don't know. You know, it's not like you inherit it. It's not definite that you will. For example, my mother had fibroids, right?
Yeah.
It's not guaranteed that I will have fibroids, but I'm at a higher risk
of getting it.
Of getting fibroids. It's like you hear for most cancers, even akina prostate CA, you hear them saying, when you go to the doctor, you can hear the doctor asking you, do you have a relative who has suffered this cancer?
Yeah.
So it's not that you inherited the cancer, but genetic mutation sometimes can be inherited. Yeah, so that's the issue. Genetic mutation is basically a gene which is abnormal, kinda. Yeah, so you are at a higher risk, but it's not guaranteed. You know, for inherited conditions, it's guaranteed you have it. So that's why you say there's a difference between inheriting a condition and just having the possibility of getting the mutation. Yes.
Every time. And of course, I wanted to ask one thing. We find that in such cases, you're told when you have fibroids, you're definitely infertile. You will not get, like where you are getting children, you've closed that chapter. And in some other cases, you see somebody has fibroids and is pregnant. So you kind of asking yourself, will this baby be a normal baby? Ama this baby will come out abnormal, or will this baby be carried to full term, or this person is at risk of getting miscarriage? So what is the truth? Will anybody with fibroids get pregnant, or will na fibroids jua tu story ya watoto umefunga, ama what is the real truth?
First I have to ask, who told you that? That, you know, when you have fibroids, you definitely won't get pregnant.
You won't get pregnant. I've had so many people saying out there.
That's probably a myth, right? A misconception. So fibroids do not necessarily have to interfere with fertility.
Okay.
It just, as I said before, the symptoms of fibroids depend on the location and the size. Yeah. Basically. So and I mentioned the 3 types of fibroids. I hope you remember, you're my student.
Subserosal
and submucosal. So the submucosal ones were the ones which were nearer the endometrium, which is the layer where the ovum is supposed to be implanted in order for a pregnancy to continue. So for example, if you have a fibroid which is submucosal, you might have the subfertility, you might be unable to get pregnant.
It's the might here. You might.
So the issue is not that you are infertile, it's that the egg is unable to implant because of the obstruction. So if that fibroid is removed, you can get pregnant. The other scenario in which you might not be able to get pregnant is the first scenario I gave, where a fibroid might obstruct the ostia, which is where the egg passes from the fallopian tubes into the uterus. So you are not infertile, you just have something obstructing, which if removed, you're back to your fertility. And then I think your other issue was now you see plenty of pregnant women with fibroids, and you wonder how that might affect the pregnancy, right?
Yes.
Yeah, so that might actually affect the pregnancy because it's taking up space in the uterus, right? And that child is the one who is meant to occupy that space. So it can cause several problems. The first being what we call in medicine malpresentation. So basically, we know that when you are at around 37 weeks, when you're near birth, your baby's head should be facing downwards. Because normally the you know, God is so creative.
Yeah.
The movements, the baby just rotates as time moves by, and eventually their head is supposed to be downwards. So when you have a fibroid, for example, it's located on the cervix. It might interfere with that. And then you will have what we call in medicine a breech delivery, which is basically the toes first, which will cause complications during delivery. That is one of the complications. The other complication is related to that. It's based on the lie of the baby. You might have a baby who's in a transverse lie, which is during delivery, the baby is lying horizontally. You know, they're supposed to be lying vertically. So, you know, it's like, imagine a physical obstruction obstructing something. So the baby is not able to move. So there can be issues with how they are lying, the breech delivery, you know, and that will interfere with the delivery process. Or the baby can be born preterm. Because again, we said issues with space.
Yeah.
Yeah, maybe
the baby and the fibroid are fighting for the space.
It can cause for the baby to be born prematurely. Yeah. And then another problem that can occur is you can have postpartum hemorrhage. Basically excessive bleeding after birth. And the reason why that occurs is because after you give birth, the uterus is supposed to contract so that the spiral arteries which supply the uterus can contract and bleeding can reduce or stop.
Yeah.
Now, if you have a mass, which is basically stretching the endometrium is unable to, first of all, the myometrium, that is the muscle layer, is unable to contract because there are, imagine now, piles of masses in the myometrium. So it's unable to contract. That means there will be a stretched endometrium and therefore excessive bleeding. And you know, PPH is one of the most common causes of death after childbirth for most women. So I will say that's a really serious complication in pregnancy. Yes.
And are there cases when a woman had fibroids and they gave birth, they carried the baby to full term and they gave birth to a healthy baby?
Yeah, the baby will be healthy. Like if they reach term, even if it's a breech delivery, as long as it's handled properly, you know, as much as those are complications, there are ways of handling them in the hospital. Yeah. Yeah, they might decide to do a cesarean section. Yeah. But now the other main issue is that sometimes when you're pregnant, maybe you had fibroids which were asymptomatic. Yeah. They might grow during pregnancy because, again, of the hormones.
Oh, so you can grow fibroids during pregnancy?
Not grow during, you already had them, but they might increase in size during pregnancy. Okay. Yeah, or they might remain dormant. It's really like...
Depends.
Yeah, it depends.
Okay, and what are the signs of, when should somebody know that, hey, this time I need to go and see a doctor or I need to go and see a specialist? What are the things somebody should look for?
So let me begin by saying, in 50% of women who suffer from fibroids, they are asymptomatic. Basically, they have no symptoms at all. So at that point, you know, you don't have symptoms, so how will you know you have the fibroids? But if incidentally you go to hospital for another condition and they are discovered, what we do is that we do what is called expectant management. Basically, we don't do anything, but we want you to come back for checkups just in case there's any change or any complication, right? So that's the first case scenario, most of the women who are asymptomatic. Then there's the woman who presents with symptoms, in which case I mentioned that the most common symptom is...
For fibroids?
I'm interviewing you now.
Heavy bleeding.
Heavy menstrual bleeding, specifically menstrual.
Yeah.
Sometimes you can have intermenstrual bleeding, but it's very rare. For fibroids, it's just during your periods, but it's heavier than normal.
So after the periods, the bleeding stops.
It stops, yes, for most people. So that is one of the most common symptoms. So for most of those people, what will actually push them to go to hospital? Because most people, they will think it's normal. You know how periods can change sometimes, and they will start having symptoms of anemia because you are losing a lot of blood.
Yes.
So dizzy-headedness, maybe you faint sometimes. They start having palpitations, which is basically the sensation of hearing your heart beat because you have less blood, so your heart is trying to pump blood faster, so you will hear it beating faster. So at any point where you start having symptoms of anemia, of course you should go to hospital. Or the pressure symptoms that I mentioned, you are noticing symptoms of urinary, you are going to the loo more often, or you have the urinary hesitancy or urgency, you should go to the hospital. Or the constipation symptoms. Basically, if it's symptomatic, you should go to the hospital. If you notice any abnormal symptoms, you should go to the hospital. And then now the approaches of management at the hospital now will determine they will depend on several factors.
Okay.
Yes. Like, how bad are the symptoms? Does the woman desire fertility or not? Yes, but we haven't reached there yet. So when we do,
maybe can daily lifestyle really influence in somebody getting fibroids?
In terms of the lifestyle, it's just the factors that I mentioned. Obesity, because of the aspect I mentioned of the fact that sometimes we have peripheral conversion of testosterone to estrogen by an enzyme called aromatase, which is located in adipose tissue, which is basically fat. So if you have more fat, you have more hormones, and that kind of predisposes you to getting fibroids. And then the other lifestyle factor is the dietary aspect, where we said red meat. Yeah, so people should really try to include veggies in their foods. Unajua watu huku nje wanaona kula nyama kila siku ni luxury. Tukiwa wadogo tuliteseka. It's time for us to eat meat. Hapana, lakini kula nyama kila siku si luxury. It actually gets boring. Like mix your food. And make
Today
it
I eat boiled, tomorrow fry, the other day nyama choma. At least
I know that's not healthy. Kuna plant proteins, I mean.
But they don't taste, they don't slap differently kama nini.
Well, yeah, but for the sake of our health, I think, people should fix their diet. Yeah, those are the two main lifestyle factors when it comes to fibroids.
And maybe how are fibroids diagnosed? Because you find that ukienda kwa hospitali, what should I expect? Ni test gani na gani? Then I'll know that when I go, I'll get this test and I'll know that I have fibroids. And this is what I need to do.
Okay, so of course, when it comes to diagnosis, first we have your clinical history, where maybe you come and tell me my periods have been heavier for this duration, blah blah blah, or maybe my stomach is distended, or maybe I have the urinary symptoms, etc., etc. And then as a doctor, I suspect fibroids among many other conditions, right? So now I want to confirm which condition is it. So the first thing I'll want to do is an ultrasound. Yeah, so ultrasound is the most commonly used imaging technique for diagnosis of fibroids. So an ultrasound will show you whether they are fibroids or something else, right? And then other investigations which might be performed, because of course the condition is associated with a lot of bleeding, we do what is called a full hemogram. Basically, we're checking your hemoglobin levels. Yes.
Oh, so those are the only tests that are done?
Not the only tests. The ones you asked me, what are the tests for diagnosis? Yeah, so the rest will depend on now the course of action we take to manage your condition, right? For example, if we decide that we want you to have surgery, I might decide to do an MRI so that I can know the exact position, the shape, An MRI is more detailed, basically. Yes, it's like 3D, it's more detailed. So I might want to see a more clear picture of the fibroids before I remove them surgically. Yes.
And maybe what are the treatments once you find out that this person has fibroids? And we have different, I've heard from somebody they had 5 fibroids. So I didn't understand 1 fibroid and 5 fibroids, because me fibroids is fibroids, but this person is said I had 5 fibroids surrounding.
Yeah, Lupita Nyong'o was saying she had 50. Have you been following her journey?
No, actually I've not. I've just heard about her having fibroids and the foundation she has, but going into details I've not.
So you can have 1, or you can have 50, or you can have 100. There is no limitation, basically.
In the same body?
Yes, in the same body. You know, my mother told me a story of a woman in the village. I think it's just like the one you told me.
Okay.
Of a woman whose belly was just growing bigger and bigger. I think, and people knew she was not pregnant. They knew she was sick. So in the village, they think it's witchcraft. Yeah, they think it's witchcraft. So until finally she went to the hospital and it was fibroids and they were removed. You know, they can be as many as even, 200. There's no limitation, and they can be a mixture of tiny ones, big ones,
And when you're saying that, is surgery the only option for fibroids? Because once somebody is diagnosed, you have fibroids, when everybody is clicking surgery.
No, not exactly. So as I said, the first thing we'll want to do is symptomatic management.
Yeah.
That means we manage your symptoms. So for example, the main issue is the bleeding, right? We want to stop that. We might give you tranexamic acid. For patients who are experiencing pain, we can give them painkillers. Right? But that is not a permanent solution. We are not we are not removing the fibroid, and that will not make the fibroid go away, but it will reduce the bleeding, and so we will solve the symptoms of anemia, right? Because we don't want a patient to die of anemia or hypovolemic shock. So basically, the reason why surgery comes up most of the time when people are talking about treatment for fibroids, because it's the type of treatment that will actually solve the problem. But now there are 2 types of surgeries based on whether the woman desires fertility or not, or maybe even not based on fertility. Some women might not desire fertility, but they just don't want the uterus removed, right?
Yeah.
So for a woman who desires fertility, they will do a procedure called myomectomy. You remember the layer was called myomectomy. So it's basically removing the fibroids from the muscular layer of the uterus. That's myomectomy, and it can be done. It can be an open procedure, or nowadays they can do it laparoscopically. Basically, it's like they insert a camera and the instruments through your vagina, then they remove it, so like you don't have an abdominal lesion.
Okay.
That's a possibility. So that's for a person who wants to maintain fertility. But the issue with myomectomy is that the fibroids might come back.
Okay. Again.
After all, like the cause is a genetic mutation. So with time, they might grow back again, or they might not. But for most people, for example, I think when I was following the story of Lupita, I think hers grew back. She had a myomectomy, and then they grew back again. And it happens for most women, I think. So the what we call the definitive treatment, which is basically the treatment that will do away with your fibroids for good, is a hysterectomy. Basically removal of the uterus. But you can see how that is not appealing for most women.
God had a purpose putting the uterus there.
Yeah, because most women maybe have not given birth at all, or some have given birth but they haven't had the desired number of children, or someone doesn't want just to have the uterus removed. But that is the definitive treatment, basically removal of the uterus.
Actually, I had this, I don't know if it's a myth or it is truth. They said if you're 25 years to 35, that it start giving birth, because once umefika 35 doc mbona unacheka sijamaliza swali. Umefika 35 years wewe na fibroids one way.
Well, okay. Actually, fibroids are most common between the ages of 40 and 50. Of course, it can occur earlier, especially in African women of African descent.
Yeah.
But they are most common between the ages of 40 and 50. Yeah, and as we said, childbirth is not necessarily a definitive way to stop fibroids. You can give, I mean, my mother has 5 children.
Yeah, now she had fibroids.
And she got fibroids after she gave, I'm the last born. She got fibroids after me. So, so it's true that we said that having no children might increase your chances of getting the fibroids. But having children does not remove the possibility, of getting fibroids. You might still get them, yes.
Okay, and some people prefer, or rather some people think, natural remedies are the best. What is your take on this?
Herbal medicines.
Herbal medicines. They are the ones that ukikunywa kikombe moja inakausha zote kabisa.
And now, you know, for me, I work with evidence-based medicine.
Yeah.
So I will prefer to recommend a remedy that has been scientifically researched and proven to work. The issue with the herbal remedies, most of them are not researched. So we do not know whether they are doing good or damage. So I will not really advocate for that. Yes, personally, I wouldn't.
Just go to the doctor, let them diagnose you, let them give you the correct. And maybe can fibroids be prevented? Because tunadungana kama watu mnadungwa sindano za polio ndio prevent polio.
Unataka udungwe kama vaccine ya malaria.
Unadungwa malaria nini, ama kama unataka kutravel unadungwa yellow fever isiku. Can fibroids be prevented?
I know, you know, the problem with medicine, as I said earlier, conditions which have been better researched can be easily prevented. For example, we know the exact cause of malaria is Plasmodium, so we can start working on a vaccine for malaria. But as I said, the exact cause of fibroids is not known. It's hazy. It's just related to the hormonal dependence and the genetic mutation. So there is no direct way to prevent fibroids. But as we said, you can avoid some of the risk factors which increase your chances of getting them, right? For example, you can adjust your diet to more veggies. If you are obese or overweight, you can lose weight, you know. You can basically make sure your vitamin D levels are okay. Yes. And then when it comes to rest, there's nothing you can do about it. So, yeah.
Actually, I had a question here. It's just that the person was asking for the ladies who have aborted before. Are there wako at a high risk of getting fibroid, and is it benign to that woman specifically who has aborted?
Basically, you're asking if abortion can cause fibroids. The answer is no. There is no direct link between abortion and fibroids. Yeah, remember, it's again genetic, hormones. So there's no link between fibroids and abortion.
So they should not fear, because I had that question. And actually,
I think people assume the worst of abortion. When they hear a woman has aborted, they assume all the gynecological conditions will come for her. They assume she'll be infertile. There's just that assumption. I don't know why. I think it's misinformation or maybe stigma around the issue of abortion, probably.
Okay.
Yeah.
Kuna wanasema stomach pain, burning sensation from diaphragm down to vulva when urinating. Now it's 4 days. Kindly advise.
Repeat kindly.
Stomach pain, burning sensation from diaphragm down to vulva when urinating. Now it's 4 days. Kindly advise.
Ask her if there are any symptoms of, the bleeding we mentioned, the prolonged menstrual bleeding or any abnormal bleeding, or if those are the only symptoms.
I think you can send in the answer to what doctor is asking. But I think she's saying she's feeling pain while urinating, and this is the 4th day.
That wouldn't really. It doesn't. That doesn't sound like fibroids. I haven't heard anything about.
It's just stomach pain and burning sensation from diaphragm down to vulva.
Okay.
When urinating, now it's 4 days.
I think I would advise her to go to a gynecologist, because there are several possible, causes for that. It might be a UTI.
Okay.
Yeah. might be bacteriovaginosis. There are very many possibilities. So she should go to a gynecologist and, you know, explain her history more
You're saying
clearly.
Bacteriovaginosis. What is bacteriovaginosis?
It's just an infection of the vagina from the name.
Oh, okay.
Caused by bacteria.
Okay. So she should go and see the doctor and
Or it
explain.
could be a urinary tract infection. You know, the issue with medicine, that's why we do not advocate for self-diagnosis, because several conditions can present with similar symptoms. For example, I mentioned the symptoms of urinary frequency, urgency. You know, that can also be a symptom of kidney failure.
Yeah.
It can be a symptom of UTI. There are so many possibilities. So we need to have a whole history. Yeah.
Okay.
So that we can make an actual diagnosis. So that is insufficient information.
Actually, I'll advise, you've not told me your name. Kindly text me the whole information, and of course tell me where you're watching from, ndio daktari aweze kupatia the right diagnosis, asikupatie wrong one. So give us the whole information so that the doctor will be able to explain to you further. Maybe, doctor, what are some of the myths you've heard from different people, or even from the patients who are coming and they're like so sure this is it?
I think most patients think fibroids are often fatal, that is, they lead to death. There's that fear. When you diagnose a patient with fibroids, they react as if it's a cancer, you know?
They know it is dead.
When a cancer, you see most patients just freeze. There's that. Then there's the aspect of the one you mentioned about abortion.
Yeah.
Yeah, that abortion causes fibroids. That's a myth. Then the other myth is, of course, I think this one is for the village. I don't think people in the village believe in the witchcraft. And then there's that myth about, you know, if you get fibroids, you are never going to get children, you are infertile. That's a myth.
Definitely.
Yeah.
There's another myth, contraceptives. People are saying when you use contraceptive or you much using of contraceptives,
or they cause fibroids.
Yes, they will cause fibroids.
So actually it's the opposite. When you use combined oral contraceptives, they actually protect you from getting fibroids. It's protective. It's a protective factor.
Oh, so they have interchanged the truth.
Yes. Wana avoid kitu yenye inaweza wasaidia. Actually, one of the ways to manage the symptoms of fibroids is you are given combined oral contraceptives.
Oh, so it will help. And actually, if you have that fibroids, there are points and instances I've had, it can shrink by itself.
So back to that, I think we haven't talked about a lot of things.
Yeah.
So back to that, I want to talk about how estrogen and progesterone are produced.
Yeah.
So in the body, there's something called the hypothalamo-pituitary ovarian axis. So the hypothalamus in the brain will produce a hormone called gonadotropin-releasing hormone. That hormone will send information to the anterior pituitary gland, which will produce follicle-stimulating hormone and luteinizing hormone. Now those two hormones act on the ovaries and will now result in production of both estrogen and progesterone. So it's a feedback mechanism. It's like a feedback cycle. For example, if I have too much estrogen, there will be negative feedback and my hypothalamus will stop producing gonadotropin-releasing hormone. It's like a negative feedback loop. So I'm trying to remember why I mentioned that loop in relation to your question.
Yeah.
Let me see. Remember, what is the question again? If they regress after at some point.
Yes.
So they regress after menopause, and they regress after menopause because after menopause there's a reduction in production of the hormones, the estrogen and the progesterone. Remember that the problem is, like, the hormones, they might not be the ones causing the fibroid, but they're the ones which promote its growth. It gets bigger because of the hormones. So after menopause, there's a reduction in estrogen and there's reduction in progesterone. So naturally, the fibroids will shrink. Also, they will shrink and disappear. Yeah, so if you had fibroids and they were untreated, then you get into menopause, they will just shrink.
Okay. I see Evelyn Keliavuli ako pale na to watch Wendy Ntinyari.
That's me.
Ntinyari.
That's my namesake.
Yeah, I hope nimepronounce vizuri.
Yeah, Ntinyari.
Dr. Rory pia ako pale.
Dr. Rory was the one who was supposed to come for this interview.
Imagine. But who's God? Who's God? Anasema
Who's God?
But Dr. Rory will be coming. Stay tuned. Dr. Rory will be coming. And of course there's Elvis Walker.
Okay.
Anasema daktari is the gold standard. Wow.
Oh, that's such a high compliment.
I'm
Thank you,
telling
Elvis.
Senor Charles Wahome anasema go daktari, future of medicine. Hey,
Wow.
I'm telling you, you are the best doctor. From these comments, you see, I bring you the best of the best. So when I tell you I bring the best
she
doctors,
actually does.
I bring you the best of the best. I think we have a call coming. Oracle TV, hello. Habari yako? Ningeomba tu one disclaimer I did not give out. When you're calling, please make sure that your TV volume is low so that tuweze kuelewana. Unajua ukitaka kujisikia na pia utake kujisikia kwa TV na unisikize, kuna mahali tutaingiliana vizuri. So I pray. Unaweza acha mtu hapo akikurecord, uende tuulize hiyo swali alafu rudi ujisikize vile ulikuwa unaongea kwa TV. But when you're calling, make sure your TV volume is low so that we can get your question clearly and daktari aweze kuanswer hiyo swali yako vilivyo. And of course, you can continue partnering with Oracle TV. It's very simple. It's very easy. If you partner with Oracle TV, you go to the pay bill number. That is 171133. Account is Oracle TV. Once you do that, you are helping us to bring on board good doctors. Daktari, nimesikia sifa za daktari hapa zinaenea kweli kweli. We bring good and quality doctors like daktari here. And if uko na swali, please uliza pale kwa comment section hapo Facebook. We are live at the Oracle Television Network, YouTube the Oracle Television Network, na pia we are live on TV. Make sure you send in your SMS on 0711-176-006 or call, and we'll be glad to receive your call. And make sure that haujabaki na hiyo swali ilikuwa inakuwasha. Hiyo swali isikusumbue na daktari yako hapa kwa ajili yako. Yani imagine I went all this far to bring the doctor to you so that you get the quality information. And the one thing that we understand is don't diagnose yourself, because you can be having simple symptoms of something else, and once you've diagnosed yourself utajiwekea ugonjwa wenye haiko. So usijitibu, enda pale kwa daktari. And the key thing is tell the doctor everything. The information that you're leaving behind might be the information that carries your deliverance, might be the information that needs to get that clear disease that you're suffering from. So ukifika kwa daktari, make sure umeambia daktari ukweli wa mambo. Usiwache kitu yoyote pale nje, usiwache kitu yoyote. Naona time inatupia kisogo. Daktari, ni swali gani usijakuuliza unasikia I have to talk about this, I cannot get out of this set kama sijaongelea hii?
Concerning fibroids.
Yes.
You know, a fun fact is that smoking may also reduce the risk of getting fibroids. You are shocked, right?
Yes.
You can start smoking cigarettes today to reduce fibroids.
Back to sender. Don't smoke.
No, don't smoke. I'm joking. No, but it actually does fact, because it reduces the production of estrogen.
Oh.
But that doesn't mean you should smoke. It has worse
effects.
Side effects, you know. Yeah, but that's a fun fact, right?
Wow, actually that's one thing I have learned today. But daktari hajasema uende pale ukasmoke. Kuna manasema good information daktari. This is munyefu na maemba. Leo I hope msinipige mawe. Mimi ni jina najaribu kuzitaja kwa uwezo wangu.
That's how it's pronounced.
Wow, yes. Munyefu. Is it in certain tribes where there's you, they put it O. So you don't know if it's munyefu or is it munyefu, but I
as long as you're not butchering it, you're fine. You're good to go.
And I hope you've learned something today. I hope now you know that fibroid is benign. It's not cancerous. And when you hear tumor does not mean that you're going to die. It just means it's something that is growing. And when it's actually I can't forget this. Nimesema nikakumbuka producer wangu. Producer wangu alikuwa anauliza fibroids zinakaaje.
I mean, it's within the uterus, it's in the body, so it looks like flesh. Most of the time it looks like a ball. It has a rubbery texture. As we said, it can be any size. It varies from grape size to even an orange or a large rock, you know.
It can be like a large rock in your stomach.
Yes, it can. I mean, why do you think some of those women we mentioned looked pregnant and it was fibroids? Do you think it was something tiny in there?
I'm telling you, salute for the women. The things women go
Women
through,
go through a lot.
I salute you a lot.
Yeah.
Maybe, Daktari, as we are ending, what will be your parting shot?
My parting shot is that to any woman, if you go to a doctor and you get diagnosed with fibroids, do not panic. Because most women panic. They think that it's like a dead sentence. You know, just, you know, consult with your doctor, chat the best course of action. And when you're given, for these women who have the asymptomatic fibroids,
Yeah.
we mentioned most of them are not symptomatic. If you're told to return for follow-up, please do. Because you never know, they might grow and then they might turn symptomatic and lead to the side effects we mentioned, such as anemia, which will have a negative impact on your health. So also we should like normalize regular gynecological checkups as women.
How regular?
You can go even every 1 month. But then to be realistic, every three months at least. That makes sense. You can go for just, you know, a general checkup, a general body checkup, not just gynecological. Yes.
Wow. And thank you so much for coming. Thank you for the information.
Thank you for inviting me.
These comments makes me make sure that I'll have another, trust me, I'll have another topic for Daktari so that she can come and make sure that I'm a deliver. At least kwa layman's language, I'm sure you've understood at least 5 things from this.
I really hope so.
5 things from today's topic, and I hope you'll get out of those things that umekuwa ukifikiria, umewaza mwenyewe, and you're thinking this is the right information. I've brought you somebody, now you know the right information, and if you feel anything, please be sure to go to your doctor and let them check on you. We are in this world but not of this world. That means whatever is happening in the world might happen to you also, and we're not saying that ati kila mwanamke anapata fibroids. If ujapata, well and good, glory to God. Lakini ukiwa pale, it does not mean it is a death sentence. You have something to work on. You have a few things you need to touch up on. Enda pale kwa daktari kuelezee what are the things to be done. Ni nini na nini. Usisikize watu. Unajua pia kuna mwenye anasema, unajua mimi nilikuwa na fibroids, I did 1 2 3. Hiyo inaweza kuwa ilimwakia yeye. But you go see the doctor and see what options work for you. And you know we have different body types. We have different things. So wewe usifikirie ujui limemwakia kwake, ita work kwako. Just go and see the doctor. And thank you so much for everybody who commented in. Thank you for the people who called. And of course, thank you for those who have sent in their messages. And if you have many other questions you need to ask, please feel free to ask. And hizo maswali mtauliza, I'll make sure nimeleta daktari ndo aweze tena kuwajibu tena, because we know masando haitukubali kuuliza kila kitu, but we can make another time. The daktari will come and tackle each and every burning question of yours. And of course, from me here, I've been your host, Trevilla. Thank you for joining in on the Health Desk, and thank you so much for partnering with Oracle TV. Until next time, same place. God bless you.